all of our minds, I think, are on the vaccine. I know mine is, and we're still waiting in our family to hear from our mum's GP about the vaccine. So we're sitting tight and, waiting. And it's frustrating because I know other people similar age, but younger, similar conditions, less serious conditions, who have got their vaccine. So Lord knows what the system is for deciding who gets it when. But let alone concerns in individual families or impatience, I suppose, in individual families. There are concerns within the health service, healthcare workers about when they will get it and the importance of healthcare workers getting it. There was lots of TV reports coming from the United States today of health workers there getting the vaccine now that it's been cleared for release in the States. They've got a number in circulation, I think, already in the States. I'm joined by Dr. Kaveri Jalundhwala, a GP trainee based in London and Doctors Association UK committee member who has concerns about this. Good afternoon to you.
Good afternoon. Thank you for having me on the show.
It's my pleasure. What are you hearing, as a doctor and as somebody who represents the thoughts and the experiences of doctor, what are you all hearing about when you will get it?
So I think the overall feeling at the moment is just chaos. It seems that over nationwide, the delivery of the vaccination is very, very random, and people aren't really sure what's happening and when their own area will be getting it. There are some hospitals and some GP surgeries that seem to have had access to vaccines for their staff much earlier than other hospitals and other areas. And there's also a little bit of chaos because I think there's been a leftover vaccine. So they were initially only supposed to be giving 5 doses. Suddenly 6 doses seem to be available from the vial. So it almost seems random because whoever is available on the day gets vaccinated, which is, of course, very frustrating for people who've been working really hard over the last few months on the front line. Many are working with COVID patients or are vaccinators themselves and are really concerned about, A, being silent carriers and giving it to the patients they're vaccinating, and B, also getting sick from this new strain of the vaccine.
And when you say 5 vials and 6 vials, is the 6th going to waste?
So initially, it comes in one vial, and the same vial has 5 doses in it. That was what we were told initially. But in some vials, there is a 6th dose available as well. And that's something new that's kind of emerged in the last week or so. And that 6th dose you have to give it within a certain time frame once it's opened. And because we weren't aware of this, it's kind of quite random now who's been getting that 6th dose because people have been trying not to waste it.
So if you happen to be there and available and healthy enough to get it, then you'll get it.
Yeah, and also if you happen to be on a WhatsApp group with somebody who knows that there will be something available or happen to be on an email chain.
You talk about chaos, and I mean, it's such a loaded word, chaos. I mean, my mental image is that these vaccines are being brought from Belgium almost in a kind of, sacred way because they're so precious to us. Do you know that that's not the case? Are you saying that isn't the case? Because chaos is a big word to use here because it's bound to be tricky. It's half a million people, we're told, have been vaccinated in the space of 10 days? That's not bad going, is it?
Yeah, absolutely. I think we've done an incredible thing in the last couple of weeks to firstly get the vaccine, deliver it to the places it needs to go, and give it to the patients that need to be given. So from that point of view, we've all done an incredible job, and I wouldn't want to detract from that. I think chaos is more how the clinicians and the healthcare staff are feeling. It's more an example of how they feel the information going to them is quite random, and B, quite often they aren't even getting information. For instance, I haven't been told when I will be vaccinated or if I will be vaccinated, or, I haven't been told anything about it. And I think that's where the feeling of chaos comes from.
And you haven't even had an email saying you'll have understandable questions about this and we'll answer them in good time. You haven't even had that?
No, I haven't. For me personally, I don't mind so much because I'm working remotely. But I can imagine if I was working on a COVID ward, daily exposing myself, that would be really quite frustrating. And I would feel like my morale would really take a hit considering how hard everybody has worked for the last few months through this pandemic.